three things to prevent breast cancer. The first one is postponing the first pregnancy beyond 30 years. Unfortunately, many women, because of their social commitments, professional commitments, they try to postpone their first pregnancy. But unfortunately, you are missing out on very important natural benefit. During the last 3 months of pregnancy, there will be some changes in the breast cells, that is, there will be maturity. Immature cells are more prone for cancer. So these mature cells are more stable and they do not change into cancer. More the immature, there is a more chance of converting into cancer. That is why a woman who is not pregnant at all or who never had a child at all is at an highest risk of developing a breast cancer. So to avoid this, have a child before 30 years. The second most important thing is avoiding adequate breastfeeding. At least 1 year of breastfeeding to a child is very protective. It has got two benefits, both to the mother and to a baby. Child will get all the nutrients possible in the world which are never available anywhere else to increase its immunity, to increase the growth and build its body and mind. And also to the mother, it is very important to prevent a breast cancer, because what happens when a woman breastfeeds, estrogen stabilizes in her body, comes down in a level, so that, because this is the culprit, estrogen is the culprit which will stimulate the breast cancer. So once the estrogen levels are minimized, lady doesn't have menstrual periods and fluctuations in the hormone comes down. So this is how a woman is protected from a breast cancer. The third and most important is neglecting the breast lump. A lump which is there in a breast need not have to be always a breast cancer, but unless you show to a qualified doctor or a surgical oncologist, you can never determine whether it is harmful or it is benign. So that is why it is very important that we do these three tests, like as I explained before, core biopsy, mammogram and examination by a qualified doctor, which will determine whether it is a benign, that is non-cancerous, or a cancerous one. If it is cancer, because remember, majority of the cancers will start painless. There will not be any other symptom other than a lump. So that is why it is more important that you approach to your nearest qualified doctor who will determine whether it is cancerous or a non-cancerous one.